Hey, it's Rich from BuildWell Health. Good afternoon, and thanks for joining me. I want to talk a little bit today about a big area that's misunderstood: peer support versus therapy. And the best way for me to do this is to just talk about a couple different categories and then point out how it's different for peer support versus therapy. So let's go. First of all, let's talk about qualifications. Who's qualified to do therapy versus who's qualified to do peer support? First of all, both are qualifications where you have to have a certifications or a license. So there's a thing called certified peer support. It's also called certified recovery support, different things in different states. And then there's also this thing called licensed professional counselor or licensed clinical addiction specialist. So there are certifying bodies for each. The main requirement to be a therapist is your academic training and your supervision and that type of background. You have to go get a master's degree, and then you have to do some work post-master's degree. The main requirement for peer support is your lived experience. Have you been there, done that? Now, after you go through that lived experience part and you identify that this is work you want to do, you do have to get formally trained, and then you have to get supervised as a peer, and then eventually certified, but the main requirement is that lived experience. Let's talk about the focus of the session or the focus of the interaction. With a therapist is focused on, first of all, getting your history. What happened to you? What are some of those issues that might be contributing to a diagnosis? That's ultimately what we want. We want to talk to the person, then we're going to move you along, we're going to figure out what your diagnosis is, and we're going to create a treatment plan. That's not what a peer support staff is focused on. A peer support staff is focused on the here and now. The way I like to say it is, a therapist is, let's look at the foundation of the house, let's see where we got some things wrong, let's figure out how we need to rewire that. Whereas the peer support staff is more like, whoa, the house is on fire, how do I help you put that out? We're going to worry about the foundation at another time. The other thing to understand about peer support that is similar to therapy is both have to be supervised. I think this is real important for people to understand. The other thing about peer support is it's just not deputizing people. They have to be supervised, and there is a professional element to it. So there's a lot more to this, folks. If you're interested in more information, check out our website, www.buildwellhealth.com, and we'll talk soon.